Okay, welcome everyone. This is Dr. Edward Kondrot, and I am very excited to present this webinar for you. And I'm amazed we have such a great attendance out there. I see Rob from Rome, Italy. We have folks from Japan, Watsu, England, and of course all over the United States. Unfortunately, this event can only take 100 people. So if you are bumped, if for some reason you can't get on and you're bumped off, don't despair. I'm going to give you a recording of this webinar and I'm going to redo the webinar. So thank you so much for attending. Let's begin. As I promised all of you, you will get a free copy of my best-selling book, The 10 Essentials to Save Your Sight. It's chock full of a lot of great information that you'll find essential to help you keep your eyes healthy. And if you do have vision loss, it's a lot of pointers on what you can do to restore your vision. You'll be getting an email from me so you could download the book. Now, those of you who may not know me, who am I? Well, I'm the only eye doctor to be certified in ophthalmology and homeopathy, board certified in ophthalmology, and my passion is homeopathy. I'm the author of 7 best-selling books. I'm the host of Healthy Vision Talk Radio. Every Sunday evening, I broadcast live, and I have great guests, and we talk about issues related to your eye. I have a medical license in 4 states. I was the past president of the Arizona Homeopathic and Integrative Medical Association. Those of you that are listening from Arizona, and I see quite a few of you out there, thank you, thank you. And I'm also clinic director of the American Medical College of Homeopathy in Phoenix, a great institution if those of you are interested in getting a homeopathic degree. I've been featured on many national TV programs in the Wall Street Journal and Martin Sheen's In Focus. So I'm very grateful and honored and privileged to have received this recognition. Now, the purpose of this webinar is not to give you medical advice or to diagnose or treat. You should consult your medical doctor or eye doctor before making any decisions. This webinar is mainly for information. The views that are expressed on this webinar are not those of the FDA or the American Academy of Ophthalmology. There are many changes occurring in stem cells and its application, and it is almost impossible to keep up to date. Now, I have had an interest in stem cells for over 10 years. In fact, it was close to 10 years ago that my wife and I traveled and visited all the major stem cell centers across the country, including the Excel Stem Cell Center in Germany. This center apparently had the largest experience in treating eye disease, but at that time, I was very disappointed in the results. Why? They were using autologous stem cells, and I'll explain a little later what autologous cells are, but they're cells from your body. So if you're an old man, 70, or a woman in her 80s, you got old stem cells. They were not very effective, and I felt that my results with microcurrent were far superior to stem cell treatment. So I really lost my interest in stem cells. Then recently, early this year, the FDA approved cord stem cells. These are extremely potent stem cells taken from the umbilical cord of a newborn. This is not embryonic tissue. The newborn baby is not touched. It's the umbilical cord, which is usually discarded. And these cells are felt to be maybe 1,000 times more potent than the autologous cells that I mentioned. And they have the ability to change into just about any specific body tissue. So the goals of this webinar. First question is, how can stem cells help your vision, and can they help your vision? Mistakes to avoid receiving stem cells. There are a lot of companies marketing stem cells, and you can get lost in the jungle of ads. And many of them are very competent doctors, but some may not be that ethical. What are the best stem cells? We'll talk about that. What is the best method of delivery? And of course, that depends on your problem that you're facing. Who is best qualified to administer these cells? And lastly, after you get these cells, or even before you receive these cells, what can be done to improve the results? Here are just some of the exciting headlines that I am seeing in major eye journals and on the internet. Macular degeneration successfully treated in stem cell ophthalmology treatment study. Now, by successfully treated, we're not talking about a return to 20/20 vision. One thing I have to make absolutely clear to all of you that are listening, stem cells are not that miracle. They will not bring your eyesight back to 20/20 or the eyesight you had when you were a teenager. Most of these studies indicate that they can effectively reverse many ocular diseases and improve vision. So that is good news because all of you want the best vision that you can possibly have. So this is one study. This is another one, retinal and optic nerve disease, a preliminary report. And this is of a 27-year-old female who lost vision. And 4 months after treatment, the acuity improved from 20/100 to 20/40, which is pretty good. It was a nice improvement. Glaucoma visual fields improve. So this is great news for glaucoma patients because those of you that are suffering from glaucoma, it is a very serious disease. And sometimes even though you're taking all your eye drops and following your doctor's instructions, you're still losing vision. So visual fields improve. An article here that a clinical study is unlocking the stem cells' potential to cure eye disease is now a reality. Exciting, exciting news. The Association in Research in Vision in Ophthalmology. What does it take to develop a stem cell therapy for the retina? Doctors are now investigating what are the best retinal cells? What is the best way of administering it? So this is a very, very exciting time for stem cell research. Scientists harness stem cells for grow your own eye repair surgery. Another article. And it states that a remarkable regenerative and therapeutic potential of stem cells. So, what are stem cells? Stem cells are a class of undifferentiated cells that are able to differentiate into specialized cell types. We have stem cells in our body at all times. So whenever you cut your finger, you don't need a stem cell transplant or therapy. Your body knows the stem cells go to that cut finger and your finger heals. Unfortunately, as we get older, when we have disease, we are losing stem cells. They're not as healthy and they're not doing their job. So stem cells can have the potential to become cells of the blood, heart, bones, skin, muscles, brain, eye, just about any part of the body. There are many different sources of stem cells, but it seems like all types of stem cells have the same capacity to develop into multiple types of cells. So when we talk about autologous cells, doctors are taking them from abdominal fat, which some of us, including myself, have a lot of, and also taking it from the bone marrow, which they go into the center part of the bone where stem cells are developed. So let's talk about stem cells. And I have an acronym called STEM cell. And let's take the stem part and we'll break that down. S, selection of the right stem cells. T, timing of the administration of cells. E, education of the doctor. Is he an ophthalmologist? And M, method of delivery. So let's take the first S. Selection of the right stem cell. Right now, there are three types of stem cells. There are embryonic stem cells. That is taken from the fetus. And in most countries, all civilized countries, this is unethical and illegal. No one is using embryonic. Cord stem cells are highly potent stem cells taken from the placenta and umbilical cord. Extremely powerful stem cells that have a remarkable ability to help the body regenerate. And lastly, autologous. The autologous is probably the most commonly used in the United States, but unfortunately, the autologous cells are not that potent, especially if you're elderly. Your body's old, and so are your stem cells. So, autologous stem cells mean they're the patient's own stem cells. And they can be from the patient's cord blood. That would be autologous. If you take it from a newborn baby, the cord blood, that would be autologous. But primarily it is taken from the bone marrow or fat tissue. But unfortunately, this is at times is a complex procedure. You have to harvest the stem cells, you have to separate them, process them, and then some way reintroduce them to the body where you want them to function. Now, the cord stem cells are what has really regained my enthusiasm for using these cells to treat eye disease. The cord cells are extremely potent, and this is where I think the future of regeneration is going to be. Cord stem cells are powerful, though multipotent, just like this strong muscle man. Now, to give you an example, when you are born, roughly 1 in 10,000 of your cells in your body are stem cells. So you can see it's a pretty high ratio, and that's why a newborn baby has such vitality and grows quickly. When you're in your 40s, about 1 in 200,000 are stem cells. So you can see it dramatically decreases. And when you're 60, well, 1 in 2 million. You're losing those stem cells. So I'm 66, and so in my body right now, only 1 or less out of 2 million cells are stem cells. Now, something else we have to look at is the telomere length. And this is a picture of a DNA strand. And as we get older, the telomere length decreases. And some tests can be done to actually measure your physiological age. So I'm 66, and if my telomere length is that of a 40-year-old, I'm pretty happy. Or if I check my telomere length and it's not that great, and I start to do things, and there are many products on the market that help increase the telomere length, I'm going to be happy. So the cord cells are very, very potent in terms of telomere length. They have the greatest ability to regenerate and divide. And in most cases, but that depends on age, they are about 1,000 times more potent than autologous cells. So that's something to keep in mind. So telomere extension turns back the aging clock in cultured humans. This is a study that was done that anything we can do to increase that telomere length can improve our health and longevity. And if you search online, there's a lot of products that can increase telomere length. And of course, if you receive a high dose of cord stem cells, you are getting those big, long telomere lengths. So let's look at the T of STEM, timing of administration of the cells. This is very important. You need to be in optimal health. No infections. Unfortunately, if you have an infection, those stem cells go towards to where there's inflammation. So for example, if you have a sinus infection or pneumonia, and you're getting stem cells for your eye, those stem cells are going to help your lung problem and your sinus, and they're not going to go to your eye or the part of your body that you want. So you have to be in optimal health, no infections. You got to have good circulation. Good circulation also corresponds to good oxygenation. So what we do at the Kondrot stem cell program, we make sure you are in optimal health, good circulation, and good oxygenation. In fact, we require that you come the day before stem cells to get your body in shape. Also, you need to detox. If you have elevated heavy metals, you got to get rid of them, or at least reduce them before you get stem cells. E is education of the doctor. I firmly believe that if you're getting stem cells for your eye, it should be done by an ophthalmologist or a doctor that is working under the supervision of an ophthalmologist. You know, it makes sense. If you're investing money in a procedure to benefit a certain part of your body, I believe that you want to go to the person that's most knowledgeable with that condition. So I think the ophthalmologist is the best person to go to when you're receiving stem cells for your eye. Now let's look at methods of delivery. The most common method of delivery is intravenous. So the stem cells are mixed with saline and slowly administered into your body through an intravenous catheter. They circulate in the body, and these stem cells begin to go to different areas of your body where they're needed. Two other methods are used in ophthalmology. One is called a retrobulbar injection. This is the needle that is placed behind the eye. It doesn't go into the eye. Behind the eye, near the optic nerve, the back of the eye, near the retina, and the stem cells are injected. Many of the major studies that are going on right now include intravenous and retrobulbar. The third method is the intravitreal. This is where a small amount of stem cells are actually injected into the eye. And many of you with wet macular degeneration know that you receive Avastin or Lucentis, these anti-inflammatory medications, by a small needle that goes into the eye. So we can deliver stem cells in this manner. So these are the three methods that are used. And the best method is determined by the ophthalmologist. It also is determined by the type of disease that you have, the severity and the location. So the second stage of the cells is continued growth of the cells. Extracellular nutrition, L light. L is low-level microcurrent, and the S, I just tacked this on. I couldn't figure out what else to put there. This is the special offer I'm going to give you because I really believe that all of you that are suffering from vision loss should consider stem cells as part of a treatment program, not only to help improve your vision, but improve the overall health of your body. So let's begin with C, continued growth of the cells. So these cells are growing very, very rapidly. Now, it makes sense that when these cells are growing, they're going to need a lot of good nutrition, right? They're going to need the right minerals. They're going to need all the substances that cells need. So it is very important that you do the necessary things to keep your body healthy and get these cells to grow. I like the analogy of a farmer. You know, you buy expensive seeds and you put them in the soil, but if you don't have good nutrients, you don't have water, you don't have sunlight, they are not going to grow. Do you agree with me? So likewise, it is foolish to receive stem cells when your body is sick, it's not in optimal health, and you don't have proper nutrition. So I can't emphasize this enough. Seeds will not plant on dry, barren soil without water and sunlight. Likewise, if you get stem cells in your body and you don't have the right terrain, they're not going to grow and they're not going to produce the effects that you want. So I'm a big advocate that food is our best medicine, and one of the best ways to receive extracellular nutrients is a proper diet. Leafy green vegetables, colorful vegetables, and I believe that raw, organic vegetables and fruit are probably one of the best things that you can do. A plant-based diet. You want to avoid genetically modified food. You want to avoid food that has pesticides and food that has preservatives. You need to really focus on your diet. And I would recommend that if you are considering stem cells, you begin to look at your diet right now. Not when you walk into the doctor's office or when you leave. Begin now. Purify your body by eating the right foods and build up your nutrients. Many times, people are so nutritionally deficient that I recommend a Mars cocktail. This is an intravenous boost, a powerful formulation of vitamins, minerals, and antioxidants delivered directly into your bloodstream. And doctors are using this Myers cocktail to treat various disorders. And of course, this is a big part of my practice during the Kondrot eye program. Everybody receives a Myers cocktail. So this is something to consider. But, when you do get the stem cell therapy, you may want to obtain a Myers cocktail every month after the stem cells, because usually 3 to 6 months is what it takes to get these stem cells anchored in your body. So you got to make sure you have the right nutrition, and the Myers cocktail is one of the best ways to go. L stands for light. Light is essential for the health of our body. Studies have shown that light actually stimulates cellular activity. There's a Russian researcher, Dr. Tina Karu, who wrote a book on light therapy, has actually identified that light stimulates the metabolic pathway of a cell, stimulating the electron transport. So we use light therapy in the practice. In particular, the bottom left is the delta laser. This is a cold laser. The cold laser has become very common in medical practices to stimulate healing, and there have been studies to show that the cold laser actually stimulates cellular proliferation and can stimulate the activity of stem cells. So when you come to the office, you will be getting this light therapy to stimulate your body, and immediately after the stem cell therapy, you'll be getting light. I feel that when you direct this energy to the part of the body that you want the stem cells to go, it will be kind of like a magnet, helping the stem cells go to that area. On the right is ultraviolet blood irradiation. We have treatments where you actually take the blood out of the body and run this blood through a powerful ultraviolet light. So you are irradiating each red blood cell with powerful ultraviolet light. It's interesting. We know that plants need light. If plants don't get sunlight, they're going to die. Plants have chlorophyll. And in human blood, we have a molecular structure similar to chlorophyll. It's called hemoglobin. And if you would look at a chlorophyll molecule and a hemoglobin molecule, by golly, they look identical. You have to give it a second glance. That chlorophyll molecule has magnesium in the center, and the hemoglobin molecule has iron. So in essence, those hemoglobin molecules absorb the ultraviolet light and help energize the body. And this is an important treatment before and after stem cell therapy. We also use a different type of light, and this is called the syntonizer or syntonic light therapy, where we don't use a laser, we use non-coherent light. Coherent light is light that's aligned perfectly, and that forms a laser light. Non-coherent light is light that is scattered, much like from a light bulb. So we have specialized filters that direct this light energy into the eye, and we find this is extremely effective in helping regenerate the eye and the optic nerve. And in fact, I believe that using the light therapy and the microcurrent combined with stem cell therapy really help potentiate the result. Low-level microcurrent is a big part of our practice. And in fact, low-level microcurrent by itself can have an amazing regenerative capacity with the eye to help restore lost vision. I really believe that everyone who has stem cell therapy should be using microcurrent before and after to help continue to have the body work and to continue to have those stem cells replicate and make a healthy terrain and support those stem cells. Here are some studies that have been done, and actually these are patents that have been submitted. Low-level microcurrent has shown to cause muscle tissue to release VEGF, and this causes new blood vessels to sprout and grow. Of course, if you have wet macular degeneration, you don't like this, but if you're regenerating some parts of the body, you want tissue to grow. Now, also, and this is really critical, that low levels of microcurrent stimulate tissues to cause the release of SDF-1. And this is a known stem cell honing signal and potent arteriogenic agent which grows blood vessels. So this SDF-1 indicates that microcurrent can get these stem cells to grow even more readily. So these signals seem to help the microcurrent. These signals seem to help the stem cells and support the stem cells in the early period. Here's another study that was done by a Korean, Dr. Cheng, and he noted that microcurrent, low levels of microcurrent, greatly stimulate ATP generation and protein synthesis. Now, what in the world is ATP, Dr. Kondrot? Well, ATP is like the gasoline of the cell. You need ATP to run your car, and you need ATP to run your cell. So he noted that low levels of microcurrent increase cellular activity by up to 500%, which is phenomenal. So once again, low levels of microcurrent may be critical to help support these stem cells and help you get the best result. So the last S I'm talking about is that special offer that I promised you. And I really have a lot of passion that I want to help all of you. And if you are suffering from vision loss and you're thinking about having stem cells, I want to make this as affordable for you as possible. So the normal cost for stem cells is between $25,000 and $50,000. I checked, make some phone calls. It is fairly expensive. And these numbers are really out of reach for most people. Now, at the Healing the Eye and Wellness Center, we have the Healing the Eye Stem Cell Program. This is a special 2-day program, and we require that you're in the program for 2 days. The first day is preparing your body for stem cells. We evaluate you, we do multiple treatments, and the second day, we do the stem cells, and we follow with some additional treatment. So it begins with an eye evaluation and testing. We want to evaluate your level of vision, and we review your records and just confirm the particular diagnosis that you have. We have pre-treatment with a beamer, which is a type of pulse electromagnetic field, microcurrent, and light therapy. And depending on your situation, we may add some additional treatments. Then on the second day, we deliver the stem cell delivery of cord stem cells. These are cord stem cells that are harvested by an FDA-approved company here in the United States called BioBurst. And those of you that might be interested, I interviewed a clinical specialist from BioBurst on my radio show this past Sunday, and that will be available if you're interested in listening to that interview. So the special is not $25,000 or not $50,000, but we have a great bargain for you, $9,995, which I think is very, very affordable for those of you that are receiving stem cells. But because I really want all of you to get the best results, with that kind of investment, you want to make sure you get the best results. We are going to give you a complimentary microcurrent machine with particular programs for your eye, for stem cells, stress, and detoxification. This is a $2,250 value, and we're giving it to you with your stem cell treatment. Now, those of you that have had stem cells this past year and really didn't take advantage of this bonus, we're going to work something out for you. We may give you a discount. You can certainly have the microcurrent machine if you want a second machine, or we will give you a discount on your second stem cell treatment, because sometimes you do need more than one stem cell treatment to get the best result. So unfortunately, we can't offer this for a long period of time, and we're going to limit this for only 2 dates. And the first date is December 15th and 16th. We have 5 spots left in this program. We can only accommodate a total of 10 in each date. And we have a January 19th and 20th date. We have 8 open in that particular time period. So if you think that this might be for you, we're doing this treatment at our wellness center in Zephyr Hills, Florida, which is just north of Tampa. So you'd have to fly into Tampa. All we need is the $900 non-refundable deposit because it's such a limited number. We can't just, we got to make sure you have a commitment for it. So if you are interested, I would recommend you go immediately to the URL below. It's Stem Cell Special, STEMCELL Special, SPECIAL.org, not .com, .org. And you can sign up immediately, pick the date that works for you. If you're not computer literate, give us a call at 800-430-9328. Oh, I'm sorry, 9328. That's a mistake. 9328. Or go to info@healingtheeye.com. So that number is 800-430-9328. All right. So I'm sure that you have a lot of questions. Unfortunately, I can't answer all the questions. So I'll take a few questions right now, and we'll see what happens. So one question is, what is the best treatment for macular pucker? Certainly detoxifying your body, microcurrent, and stem cells. So these are great modalities. We've treated many cases of macular pucker. To be honest with you, macular pucker is tough to treat. It's a wrinkle, it's scar tissue. So we begin with microcurrent. I really think you have to detoxify the body. The question is, how does one find out the approximate cost of stem cell treatment? Well, I don't know if you were paying attention, but the cost varies from $25,000 to $50,000, but we have a special at the Healing the Eye and Wellness Center for $9,995. And for those limited 2 dates, we are going to be giving you a microcurrent study. Any studies, stem cell therapy for Fuchs dystrophy? Well, Fuchs dystrophy is a corneal problem, and the corneal problem is in the inner layer of the cornea. So I am not aware of any studies, but I would recommend microcurrent and ozonated saline drops. I have treated many patients with microcurrent and ozonated saline, and they have responded extremely well. Will stem cells work for cataracts? Unfortunately not. The cataract does not have any circulation. So if we put those stem cells in the blood, they're not going to go to the cataract. But what does work for a cataract is detoxification and getting rid of heavy metals. What is the treatment for rod and cone dystrophy? Well, that's a congenital problem, and sometimes you can have quite severe visual loss. I do not have any experience in treating rod and cone dystrophy except using microcurrent. I've treated 4 cases of rod cone dystrophy, and they have had an improvement with microcurrent. I do believe that combining it with stem cells, we should get a good improvement. Is there research for healing damaged veins from a branch vein occlusion with stem cells? I'm not really familiar with any studies healing a branch vein occlusion, but we can heal or help heal the end results of a branch vein occlusion, which is damage to the retina. So certainly microcurrent and other therapies that we do, including stem cells, could heal that. What do you do for blindness of one eye due to vascular deformity and a bleed? I think that we would really have to do an evaluation and review your records on that. We have to look at the extent of the deformity. And please understand that, stem cells can help most eye problems tremendously, but it's not a magical cure. You really need to do a lot of other things that I mentioned. You need to detoxify the body, improve the circulation, oxygenation. Right now, I think that stem cells are an excellent adjunctive treatment to any therapy like microcurrent or nutritional therapy and things like that. All right. Will the treatment help or even reverse open-angle glaucoma? Well, stem cells and microcurrent combination and light therapy can help glaucoma. That is, I've treated many patients with this condition, and unfortunately, traditional ophthalmologists do not look at the underlying cause. They are mainly trying to lower the pressure, and I think the cause is the optic nerve. So all these therapies should help. So just a correction here, it's the wrong phone number. It's 800-430-9328-29. And you can go to stemcellspecial.org to register. So I'm out of time. I want to thank all of you for attending. And please, if you're interested, get in touch with the office. I expect these spots to go quickly. And take advantage of the special offer and begin to restore your lost vision. So this is Dr. Edward Kondrot wishing all of you good health and clear vision.